Okay, so we are live. Good evening, everyone. We're back with another weekly career class. And today we have with us Miss Sneha Aggarwal, who is a senior optometrist she's from All India Institute of Medical Sciences, that is AIIMS, New Delhi. And currently there she is looking after low vision services and irregular cornea management at the National Research and Training Center for Low Vision and Rehabilitation Services. So, Ms. Neha, welcome. And today she will be presenting on the topic career in optometry, as mentioned in the title. So, welcome, ma'am, and over to you.
Thank you so much. Thank you, Samarth, and thank you, Career, for giving me this opportunity to talk about career in optometry, a profession which I adore well and which I'm passionate about, which has given me a recognition. And I'm gonna talk about few of the career option opportunities which are there, few of the challenges and rewards of the profession, and how this is an ever-growing opportunity. So as Samarth has mentioned, I'm looking after low vision and contact lenses, which is a very specialty area at RP Center, which is a part of AIIMS, New Delhi. I'll just, guide you all a bit about it via my experiences. Uh, I'm going to talk about educational journey and professional journey and what is optometry all about, career option with specializations, a few course options or entry paths leading to it, and rewards and challenges and work-life balance. Because ultimately, we all look for the satisfaction, in our lives when we go back home via performing anything day out. We look for some, security and satisfaction. So, what is optometry? It comes from two words, optos and metry. It is a specialized healthcare profession and it involves the examination of eyes and related structures. So, as an optometrist, the primary eye care comes under the arena of allied health sciences, and it is all about examining the eyes. We are the eye care providers which look at the refraction, like prescription of glasses. So most of the glasses which are being worn by the individuals or anyone, by you or somebody else, are being prescribed by optometrist. The dispensing of the glasses, the contact lenses, so the contact lenses are multiple areas where they're specialized, where they are cosmetic contact lenses, low vision devices, the detection and management of the diseases. So this area is, not complete. It is shared partially by the ophthalmologist and by the optometrist. And this degree comprises 4 years of education, including 1 year of clinical internship at a tertiary eye care center or at a secondary eye care level as well. So who is an optometrist? So they are the healthcare professionals who are, the primary eye care through comprehensive eye examination to detect and treat various abnormalities in eye diseases. So the visual rehabilitation, vision therapies, the glasses, contact lenses, the low vision, and a lot of things are being covered. This, wider areas are being covered under this profession. The term optometry comes from a Greek word, opsis, view, and metros, to measure. So all the measurements which are being done in view of any surgery, in view of any rehabilitation or management are being carried out by optometrist. Why we choose optometry? So you guys are at a point where you want to relate yourself to various professions, we all want to seek, better guidance where what are the, glorious or, gratifying or satisfying career options in terms of, patient dealing with, in terms of corporates, in terms of any area we talk about. So it has like few reward society. We keep interact with the society. We have a deep touch with the universities because a lot of time is being spent with the teaching, caring for the society, examining patients. So we deal with the patients directly. Any country we deal with, because every country has its own set of rules and regulations, hospitals, corporates, and people, a group of people, NGOs. So it is all about improving quality of life. So if we see what is the user end is the patient, the customer. So we call the patient in terms of different, by names, like when you go to the optical outlet or MNC, they will call, the patients as the customers. When I'm in a hospital setup, eye quality of the patients, but the individual remains the same. So optometry education today in India has, the duration is around 2 to 3 years. Now it has been upgraded to 4 years. Initially, it was initially this program started as a diploma. Now it earlier then it was the the basic sciences like BSc, MSc. Now it is like a master's and bachelor's or master's. So the optometry has got a full recognition. Objective is to have independent, educated healthcare professional equipped with eye care. So, in other areas, when you go to the MBBS also, there is a general, knowledge about the whole body. Then you go towards MS like ophthalmology. But in optometry, you are straight away dealing with the patients. You are straight away into the eye examination. So, optometry, it is a specialized field which caters to the eye-related problems, eye-related disorders, and the optometrists are involved in management of that. So curriculum has evolved over the last 3 decades, and dedicated teachers are now available. Teaching methods have become better. Patients are getting better eye care. And what are the goals in comprehensive optometric vision care and rehabilitation? So as I mentioned, we straight away deal with the patient. So initially the task begins when we identify and evaluate the patient, assess the ocular health. What are the problems? We take a detailed history of the patient, why, when, where, and how the problem has begun, emphasize the need of the patient, clinical assessment depending upon the need. The whole idea is to maintain and improve the quality of life, maintain and improve the disease, to cure the disease. Then the optometric rehabilitation intervention comes into, and it plays a very, very important role. The counseling and educating is a very important part, and the appropriate referral. So in India, the specific criteria is not labeled. A patient or a person can go to anyone, like an optometrist also, or an ophthalmologist also. But in outside India, where like in UK, US, where the higher bodies are, where the science and medical facilities are, more evolved or better parallel, programized, they go to the optometrist first. So the idea is, an individual has to visit an optometrist. Optometrist will diagnose, categorize the problem or the ocular health. Depending upon that, the individual would be referred to the ophthalmologist or any other referral or intervention if needed. And a leap from Maiden, so it started, in 1950s and 1960s with the diploma in optics and refraction, as I mentioned, in popular institutes like Aligarh, Singapore, Hyderabad, and Delhi. And in 1976, in the tertiary or the Apex Institute started the course combined the diploma in optics and refraction and orthoptics. And they all were covered under the program called BSc program. So it was BSc Honors Ophthalmic Techniques. Now it is Bachelor of Optometry. And in 1980, the private institutes like Yale School of Optometry started the 4-year optometry graduate program. And this really brought a lot of clinical aspects to the optometry practice. So what are the trends of the different practice, joining family optical businesses? You must have heard of the popular chains which are there in the market, eye hospitals and teaching institutes. Now, it is towards more regularization, so more opportunities are coming into the market. The formulation of Indian Optometry Federation and Indian Optometry Association, Optometry Council of India, which are dedicatedly work towards the improvement of the courses, curriculums, and the stabilization of the field in India. There is association and colleges of optometry for education to check the quality control, and India Vision Institute and Optometry Council of India. So this is a chart basically how these bodies are into it. But we need to look more towards the outreach opportunities or programs. So educational institute, optometry research, and corporate world. All these areas are divided into these specific areas. We're going to talk about all these prospects individually. Optometry career options, if we talk about like optical stores, optometry clinics, hospitals, others, and optical stores, you must have seen like spectacles and contact lenses. Now the chains are coming up like Bonton, Carver Opticals, or Lenscart has got a chains. So a lot of evolution has happened in all these things. Optometry clinics like low vision, vision therapy, these are the specialized areas. Hospital, the clinical and investigations, and others is the teaching, research, and corporate profile. Now, if I talk about the optical stores, whenever you look for a spectacle, it is so easy to visit an optical store, get your eye examined, and get a spectacle power. Now we focus about like preventive eye care also. So like I'm wearing a glasses, I need it for the vision. I want to see better, I need glasses for that. Beyond that, now we have dark adaptation glasses for the quality control of the like vision. If some patient is photophobic, sunglasses, prescriptive glasses, digital strain glasses, anti-reflection glasses. So it is all about different types of customizations a particular person needs, catering to the quality of life, profession, hobbies, and different ventures. Optometry clinics, they deal with all the specialty areas. Hospitals, like a cataract surgery needs to be done, or a patient needs to be treated for an infection. Different investigations, clinical investigations are being done by the optometrist. Teaching and research, because in different institutes where the optometry programs are running, teachers have a big role to play. They talk about different principles of optometry, different devices, instruments, investigations, community outreach, and different corporate profiles. So, what is the ratio of these individuals are going into it? But now there is a big paradigm shift in these, this thing. Who are the stakeholders? Optometrist deals with the patient, consumers, business owner, independent optometrist owner, optometry educators, optical industry. So these are the people like who go into various areas and have their own independent businesses. Educational institutes, development of optometry education and dedicated teachers for optometry, development of human resource and infrastructure for professional and regulatory framework of optometry, arena for masters, PhD, fellowship programs, and various trainings. So when a student graduates from an institution, like after doing the optometry, what are the different fields a person can go? Now there are like well-established masters programs which provide a specialization, which provides a different type of teaching, enhanced version of teaching, which deal with the statistics, which deal with different areas of practices, which deal with different areas of training. PhD programs are there, and a lot of my colleagues, my juniors and seniors have gone out for the PhD and fellowship programs outside India. So there is a different framework of education and teaching and training in India versus outside India. Outside India, there are different PhD programs which are specialized, better organization. So we need to improvise a lot upon this. Research framework, scholarship for students or optometry students and undergraduate or master's students or PhD fellows, which can apply for the contact lenses. Now you must have heard that smart contact lens has come into the market, which will track the activities as per our basically the smart watch is doing. It talks about the what are the tears, what is the diabetic ratio, whether the patient has put any medication on the eye or not, what is the status of the patient, where the person is looking. So it tracks all the movements. So smart contact lenses there. Low vision in assistive devices. You must have seen, people in they walk with the cane, they are blind, they have low vision. You must have your colleagues also in schools and all that. So when I was a student, I had, two of my colleagues, one had the eye movement, which was constantly happening, and I wasn't aware of that. What is this? So we thought it is a natural habit of that person. But when I came into this profession, I realized, oh, this is a specific type of a problem, and how we correct this. And these type of children or these type of person are dealing with specific type of challenges in their lives, and how the optometrist and eye care practitioner can help these people in having a better framework for their education and rehabilitation. Pediatric optometry, which is dealing specially with the kids, infants, toddlers, like 1 to 5 years, and they deal about their prescription of glasses. So it is really a very interesting area where they see around 1 month old babies, 5 month old babies, and something like this. So it is very difficult also to deal with those patients. Plus, it is very interesting to give sight to a 1 month old baby who is born with some sort of a deformity or abnormality, something like this. Community eye services and public health, it is very important because we all like are sitting in our offices, hospitals, big centers and setups, but who goes to the peripheral areas to recognize the problems in the communities. In India, like if you talk about like towns, cities, now going to the villages, going to the rural areas, because we all want to go towards more urban lifestyle, but the community has a big role to play in it. So there are various type of deformities or eye problems, eye infections, which have been tackled by the community people, and they provide a good survey that what is the extent of an eye disease or eye problem, or how many patients are suffering, how many people are suffering from that level of problem, and what is the ratio of the health there. They give us the feedback to the higher centers. Then they are the trained people who go and take care of people in the rural areas. Diagnostic devices, a lot of devices which you see, when you must have gone for your eye checkup, there was a simple setup, go for the eye evaluation. Now they are very high-fi machines and a big setups and a big many investigations are being done. So they all are performed by the optometrist basically. Whenever you hear of a new drug which has come into the market, a new medicine which has come into the market, so clinical trials. So optoms are being actively participating in the clinical drug trials where they try the new medicine. There are the different type of studies which are happening at the scientific level and the research level, and for the benefit of the patients. So few students from RPC, from my center, have got scholarship also to conduct research in different specialties. In India, oh sorry, this is repeated. Basically, what we are looking for the improvement. If there are any lacunae, because each field has its own limitations and basically, the pros and cons of each and everything. So, what are the limitations and how we are going forward in the optometry education? So, if you want to find out what are the things an optometrist is doing and what are the things they can do for the better patient care, for the better contribution in the society, if they what are they learning on the job and how much they are catering to the society, because an institute might teach a lot of things, but how much they are giving back to the society. So, the major areas which are being involved: clinical procedures, refraction, contact lenses, low vision therapies, and the independency of the profession. So, optometry career in many terms it is financially rewarding because 70% optom grade works in a retail optical sector, optical chains. They have their own clinics because it is an easier task also to have an optometry chain to have an optical sector, but managing and seeing the patients and the people in that and serving in that manner is itself a big point. So basically, there are a few points. Today things are not what we all want to be them, and what are the stops for the improvement. And we need to create awareness about the professional eye test, because we don't want eye test to be customized, categorized, and done in an appropriate manner. All stakeholders need to be involved in this to have a good cheer time, because when I go for my evaluation, I really want somebody to look after my eyes in a nice manner. Optical business owners encourage optoms for different opportunities, and basically we need to change and influence the environment, change the mindset. It is not a peripheral field the you should choose for. It can be a primary occupation, a satisfying occupation, which you all can, many of you or most of them, or most of you can opt for. So I had a good opportunity to basically have a scientific contribution for myself, being in the Ethics Institute, because AIIMS is a big institute where a lot of research is happening. And as an optometrist, I have contributed a few chapters, research papers in the books, and writing about my work, writing about my how we do see the patients, my experiences. It has come out in the form of papers and scientific and clinical presentations. So a lot, conferences are being organized where we can showcase our work, where we can showcase our evidence-based practices, where we can highlight what are the learning points, where we can teach and gather. There are the scientific areas where we all gather, discuss our work profile, share our knowledge, get back to our pavilions, and imply that knowledge to have the better assessment for the patients. So this is, we are a WHO collaborative center, and we had a WHO workshop with WHO for better, patient care, so that we all can go in different areas. Field of employment, basically hospital, corporate, clinic, optical industries. Now, if we talk about the hospitals, there are general practices and there are specialty practices. So in general practices, what happens is that it depends upon what kind of setup the person is working in. It can be the conventional manner where the optometrist is evaluating the patient and all that, where they are teaching students, training them, designing and development of various projects to seek funding, to seek develop new device, because our honorable PM keeps on talking a lot about indigenous devices, Ayushman Bharat, Make in India approach, and you will be surprised to know a lot of things are being imported. So a lot of research needs to take place. Whosoever are interested in research and all that, optometry has a big opportunity to customize the devices for the patient care in India. Because if you get to know, the most of the spectacles and lenses, the spectacle lenses are being designed outside India. The contact lenses, if you are wearing anyone, are being designed outside India. We need to have more setup, more industry setup, more homemade, make in India manufacturing things, so that we can cater as per our patient needs, counseling and communication, how to have a better life. So, direct services, interaction with the patient. It is non-surgical. If you guys are not interested in surgery, if you find surgery is hectic, surgery is not for you. If you are inclined towards academics or clinical, then it is an area where you can think upon, where you want to like work in research or scientific areas. Again, a good opportunity. If you want to have a work and family life balance, again, a good, kind of a tick mark opportunity for you. Industry opportunities, if you are more inclined towards like corporate, so few people think about doing MBAs or few programs. So there are the trainings, So one is like we have seen is the hospital teaching. The other is the corporate teaching. Because whatever is coming new into the market, the corporates have a very good idea about it. Now the corporate people are coming to the hospitals, to the clinics, to teach and train their counterparts. So optometrists, are doing this fantastically because they have the knowledge about eye care system, and they go on various field platforms where they tie up with different hospitals and people or like NGOs. They teach and train, research, quality control, train for the internal and external examination. And these are the industries which are like Bosch& Lomb, Alcon, J&J, Puricon, Contact Care, Cooper Vision, and a lot many more coming into the market, which looks about the manufacturing, which gives these kind of opportunities. So what is the brand venture? What are the different components they have? Like service component, device manufacturing, training, support system to ophthalmologist, optoms. So an optoms who has graduated from a college can be a support system to an optom who is practicing in the hospital. So it is kind sharing more fields and development of devices. Again, independent practice like frame selection. You must be surprised to know about there are specific driving lenses adaptive lenses, anti-fog lenses, anti-glare lenses, for the cosmetic rehabilitation, vision therapy. So, cosmetic rehabilitation, I have not used the proper term. It would have been a bit cumbersome. But, as cancer is there, so a person might have an eye cancer. And to treat that, the chemotherapies are being given. But if it is not treated, then whole of the eye is like enucleated, it is taken out, the socket which is there. So that cosmetic part, the designing of an eye, is being done by an ocularist. So there, under optometry only, there are different areas which look at different parts of the system, like cornea, which provide contact lenses, the retina, the back part of the eye, cosmetically managing the patient. So there are the diamond embedded, gold embedded contact lenses are coming into the market. You must have seen the serials like Nagin, the movies, where Sri Devi has haunted all of us and attracted all of us via her big, beautiful eyes. And she was wearing hazel colored lens. That was the scleral contact lens, specialized contact lens, she was using. So when we see any type of special effects in the eyes, that is being done by the optometrist. So these practices are there. So one of my, colleagues has the tie-up in the film industry, Bombay, where he gives like a different type of contact lenses. So if you are interested in that glamour world also, you can think about choosing your option there also. So a different type of spectacle industries are there. Then there is the co-management, where an optometrist and an ophthalmologist. So optometrist, who is non-MBBS, has done the specialty optometry course, an ophthalmologist who has done MBBS, and after that has opted ophthalmology as the main, field. So they can tie up with each other and have the co-management, in like co-management, that they both of them are doing the management and for the patient care, for the better outcome of the results. So take home message. It is a very, kind of noble profession. I really adore it from my heart. And we all are responsible for the eye and vision care needs of everyone in the society. As a student, I wasn't aware of this profession. But when I was giving, different levels of my entrance examinations, I came to know about it. And I was really fascinated by the course. Okay, this is nice. And so when I got into this profession, I got to know more detail about, okay, there are so many children who are blind, who can't see really well. So many children are having low vision. And I really wonder that these children are leaving their education because they can't see well. They are sitting at home, they can't have their professions. And we want, if we empower a person, we'll really feel more strengthened. It is a profession which will make you earn respect, a good professional recognition, and be proud of what we all do in optometry. Demonstrate your professionalism in our actions, because actions speak louder than words. And respect ourselves, because optometry will get its due respect, because everybody thinks of going towards main medicine, because it is more fascinating. People are relatively a bit apprehensive about elite, but I really feel this is a very good area which is undue recognized. Because if I see in my whole fraternity, a lot many doctors are doing eye examinations and all that, but a lot of surgeries are pending, because eye examinations have big glue. So if optometry is well balanced, and if it is made the primary career choice by the students, by the fellows, a lot of good thing has yet to come. A lot of good make in India opportunities are lying up ahead. We are going more digital. Smart glasses are coming into the market, like the smart watches. And thank you so much for the kind patient for the listening. Hope I was able to do justice. This is my email ID. You may ping me on. Thanks, Samarth and I Dream Career and Dr. Shruti for inviting and giving me this opportunity. Thank you so much.
Thank you, ma'am. Thank you so much for the very informative session, and also drawing attention to the fact that this field is indeed very important, and it is a noble profession indeed. So thank you for driving that message as well for our students. Definitely, it will help them be more aware. Also, now we have come to the Q&A session. So if any of you have any questions, please drop them in the chat and ma'am here will answer it. Also, so far we have some queries here in the chat box I can see. So one is, can an optometrist prescribe medicines for eye disorders?
So there is a bit of kind of basically there are two options for it. The one is that the normal lubricants are being prescribed by the optometrist, so they are very general. In India, usually not, but outside India, optoms are prescribing medicines also. In India, they are not allowed to prescribe medicines and antibiotics to cure any disease. We have to refer the patient to the ophthalmologist for further care and management.
Okay. And the next question is, can we take spectacles based on an optometrist prescription?
Yes, yes. If you are a fan of like KBC, Kaun Banega Crorepati, a question was being asked by respectable Amitabh Bachchan ji, like who are the people prescribing or responsible for the primary eye care examination and prescription of spectacles? The correct answer was the optometrist, and the optometrist column was there. So ophthalmologists are also prescribing glasses, but none of the ophthalmologists are really carrying out that part of examination. If somebody is wearing glasses, I hope that eye examination was done by optometrist only, because that is their specialty. So that is a green go signal. You can get your glasses from the optometrist itself. So next time if you go to make your glasses, you can really ask whether you are an ophthalmologist or an optometrist.
Right, right. So great insight. Also, do optometrists receive emergency calls from patients, or is it like any other conventional work role?
Yes, they do receive the calls depending upon area where they are working. So a preliminary guideline can be given by the optometrist, but there is some ocular emergency which requires some surgical intervention or medical intervention, like to operate any surgery or to prescribe any medicine. That is referred to the doctor. Moreover, ocular emergency means related to some accident or trauma or eye related infection. Usually, the patients are guided to the ophthalmologist.
Right. Also, ma'am, I also have one more question. If you could like elaborate on the difference between ophthalmologist and optometrist.
Okay, so a very nice question. Thank you for asking. Optometrists are the primary eye care practitioners where the MBBS degree is not allowed. After 12th, you straight away can have the entrance examination. So few of the universities are offering the entrance examination. Few of universities are direct on the like interview basis, offer you the optometry course. It is a 4-year degree program, and in terms of this is the educational qualification where you prescribe glasses, contact lenses, basically looks after the welfare of the patients. So any squint related disorders, workup areas, vision therapies, rehabilitations, counseling, providing different aids for the patient. Whereas an ophthalmologist are, so they have the basic degree, medical degree like MBBS, which is via the NEET examination. And after there is an examination for the PG medical entrance examination where they opt for ophthalmology. And it is like MD or MS ophthalmology. Then they can prescribe medicines, they can do surgeries. That is the difference basically.
Thank you, ma'am. Thank you for that answer. Okay, so do we have any more questions? Please let us know. We'll wait for like, okay.
There is one question how it is
Yeah,
different from ENT doctors.
right.
Okay,
Hmm.
ENT doctors are like they look after the ear, nose, and throat. So the ENT term gives the hint ear ear, nose, and throat. Where optometrist is only eyes. So ear, nose, and throat they look after like if there is a infection related to the ear, nose, and throat, all this kind of infection. Where optometry like optometry, it looks after only the eyes and related ocular disorders. Now we are more going towards like visual rehabilitation. So if any accident has happened and the patient's brain or the patient has been operated for the brain tumor or something like this, where the patient loses the vision. So therapy is also given to that extent. So ENT is totally different, which caters to different organ, but optometry is like brain related, rehabilitation related, and eye related problems.
Right, right. Okay, so there's also one small query. The student is asking if after 12th can we do this course? So you have already answered that, right?
Yes, yes, very much, very much. Yes.
Also, as an optometrist, how challenging is it to convince a patient to wear spectacles whole day who are suffering from myopia? We have this one more question.
As an optometrist, how can you convince a patient to wear spectacles whole day who are? Oh, very nice question, actually. Myopia is a leading kind of a pandemic, if we talk about, because, and myopia has grown in the last 2 years due to the indoor activities, due to the pandemic, COVID. We all were like indoors and we all were toward the digital screen. Most of the students were watching or doing their homework, attending their classes via phone and laptops or computers. So, as you rightly say, myopes are the people who can see very well for the near, but for distance, they require glasses. So, optometrists are one of the best people to guide about that, because if you don't wear your glasses, then your eyes are always looking, to look better, to look more clearer, and your eyes are always training to see better, and it leads to a chain, different principles in the eye, which leads to the increase in the power. So if a person is not wearing glasses, squeezing, or making an effort or bringing down the objects closer to see better, they might end up having increased powers. And yeah, basically a lot of eye studies are being conducted on myopia nowadays. And now myopia societies are coming up, where we are looking into the 4 or 5 fundamental preventive mechanisms, where the optometrists are playing a very very important role to prevent myopia, to prevent progression of myopia, and how we can treat patients better, or how we can make the children spectacle free. So there are different therapies which are coming. So there is a type of contact lens which is there into the market. If you wear it in the afternoon while you are awake, while you are asleep, and you wear that contact lens while you are asleep, and then you remove them when you wake up. So your vision will be cleared for the day, and you do it daily actually. So optometrists are kind of good advisors for the myopia control, and to convince patients to prevent myopia or to use glasses in myopia.
So one more question, ma'am, difference between BSc optometry and MD optometrist.
MD optometrist.
Optometrist. I believe he means difference between BSc optometry and MD optometry course.
So there is no term MD optometry actually.
Okay.
Outside
Okay.
in India, it is somewhere it is like BSc optometry. Nowadays, it is like everywhere it is bachelor in optometry or like bachelor in vision science or something like this. The private universities might have it, but it is like bachelor in optometry. MD is like MD is ophthalmology. It's not optometry. But
Okay.
outside India, it is OD, like doctorate of optometry. It is OD. So after once the person is doing the bachelor in optometry, it is like in India we do master in philosophy, like masters in optometry, something like this. But outside it is doctorate of optometry. So they do write OD optometrist. So MD is not a term.
Okay. I hope your question has been answered, Vicky. So do we have any more questions? All right then. So we have come to an end of this session. Thank you, ma'am. Thank you, Miss Neha, for joining us. Great session. And thank you all of our viewers also for joining. Miss Neha, yes, you were saying something.
Thank you so much. If there are any queries, Samarth, you can always forward. I'll be happy to answer. and hope I was able to do justice and to solve out the queries.
Yes, ma'am.
Whosoever is willing to come into the optometry fraternity, we all welcome them to join us. Thank you so much. Thank you, Irene Carrier, for having me as
Thank you, ma'am.
yeah.